Okay, welcome everyone. Today for our conference, we're going to be discussing some things that future healthcare professionals should know about hearing impairment and hearing loss especially in older adult populations. And we've got some experts here today to teach us a little bit about that. So here are the members of our team. Thanks for being with us today, guys. And so here is a little bit of what we have on the agenda today. First, we'll kind of talk about what hearing changes are, the signs and symptoms of those, how to diagnose it, some prevention and treatment, and then we'll have some time for questions and things like that. Okay, so first for the signs and symptoms, some of these are kind of obvious, but some of these you might not think of right off the bat. We have muffling of speech and other sounds, difficulty understanding words, especially against background noise or in a crowd, trouble hearing consonants, frequently asking others to speak more slowly, clearly, and loudly, needing to turn up the volume of the television or radio, withdrawal from conversations, avoidance of some social settings, and tinnitus. And looks like 44.4% of adults between the ages of 65 and 74. And this is the poll that we did with the class.
And then so there's kind of just two basic kinds of hearing loss. And so I'll kind of just show you the anatomy here a little bit to help you understand it better. But there's conductive hearing loss and then there's sensory neural hearing loss. And so for conductive hearing loss, there's three parts of the ear. There's the outer ear, which you kind of think of as like out here by like it's called the pinna of your ear, all the way to your eardrum. And then there's the middle ear, where you have these three little bones that kind of help transfer the sound into your inner ear, which is your cochlea. And so conductive ear hearing loss is any damage that happens to the outer or inner or middle ear that results in you being unable to like transmit those sounds to the cochlea in order to hear them and then convert it into a signal to send to your brain. And then sensory neural hearing loss, if you look here at the diagram of the cochlea at the bottom right here, is any sort of damage to the cochlea, either the membrane that runs throughout the middle or any of those fluid-filled tubes on the outside that make it so that the signal can't be interpreted there. And this sensory neural hearing loss is actually the more common form and is generally referred to as presbycusis, if I pronounced that right. I hope I pronounced that right. But it often happens towards the front of the cochlea because that's where the loudest noises come in. And so I think we'll be talking about that later, like what causes hearing loss, but loud noises is a significant thing. And it usually damages the first part of that cochlea, which results in you being unable to hear like high-pitched noises and high-frequency noises. So I think that about covers it. Does that sound good, Ella?
Yeah, thanks. That was really helpful. So next, this is another question that was from our poll, and is hearing impaired a socially acceptable term? So I think this especially is something that applies to future healthcare providers, knowing how deaf people and hearing impaired people prefer to be referred to. And here are the results from the poll. And it looks like 50% of people said that it is acceptable. 38% of people said it's acceptable for people with partial hearing loss. And 11% said that it is not an acceptable term. And I believe that the real answer to this is that it is acceptable for people with partial hearing loss only. So deaf people don't want to be referred to as hearing impaired because they consider themselves part of the deaf community. Okay, now we have this little whiteboard animation here that is just some basics about understanding deafness, and I think it's pretty helpful. So we'll just play this.
Hi, my name is Ben, and this is my friend Jerry. He's deaf. Do you understand what deaf means? Maybe you have some deaf people in your class. Well, why don't Jerry and I try and explain it to you today? Being deaf means that Jerry isn't able to hear. So when you hear the sounds of a car honking its horn, or birds tweeting in the early morning, Jerry cannot hear that. So if Jerry can't hear, how do we talk? We communicate through sign language. In Australia, it is called Auslan. It is a series of movements through your hands that mean different words. So when Jerry signs this, I know he means food. How do people become deaf? It happens for a lot of different reasons. Sometimes babies are born like that. Or sometimes people can become sick, and that can make them unable to hear. Doctors can sometimes help people who can't hear to hear. This is called a hearing aid. It is placed on the outside of your ear and helps to make the sounds louder. This is a cochlear implant. After a special operation, this is placed outside of your ear and can help make you hear again. Luckily for Jerry, the doctors helped him, and now he has a cochlear implant.
So now we're going to hear a little bit from Brittany about diagnosing hearing loss.
Okay, perfect. Thanks, Ella. So yeah, for diagnosing hearing loss, there are two steps or two ways that this can happen. So first, the person who thinks they have a hearing loss can go to their healthcare provider to get a checkup to see if they have hearing loss. To do this, the healthcare provider would look for damage to the eardrum, if there's any blockage in the ears or any like foreign objects in there, or to see if the ear is inflamed or has an infection. After that, the person may be referred to a specialist like an audiologist, where they can go and get an audiogram. For this, they would get tested with headphones to see if they can hear different sounds with different frequencies or loudnesses. After this, depending on what they can and cannot hear, then that could show what kind of hearing loss they have and like how bad it is. Yeah.
Perfect. Thanks, Brittany. Now we're going to talk about risk factors and prevention, and I think Josh is going to talk to us about this a little bit.
Yeah, perfect. So first is this little question here: is hearing loss preventable? And most of you guys got it. 72.2% of you. Hearing loss is actually preventable in almost every single case. And it looks like some of you guys in the orange and green here too got it as well. That there's different types of hearing loss, and you can take measures to prevent it, but it's not necessarily a foolproof thing. And so when we're talking about like risk factors and prevention for hearing loss, we're pretty much just talking about the causes. But something that was mentioned earlier in the signs and symptoms that I wanted to highlight here is that a lot of people who have hearing loss or who are at risk for hearing loss are kind of more socially withdrawn people. And so that's definitely something to keep an eye out for among your friends and family, to make sure that they're all right. And then another thing to mention there is that pretty much every single older person is at risk for hearing loss, like I described earlier with the sensory neural hearing loss in the cochlea, because they've been hearing sounds for so long of a time. It's easier for them to be damaged. So Ella, if you want to go to the next slide there. So for causes of hearing loss, as you'll see here on the right, 1 in 4 people experience hearing loss due to exposure to loud noises. And so we have this diagram here on the left of the two different kinds of hearing loss and things that can affect both of them. And so some things that I just wanted to highlight on there, of course, aging and noise damage are kind of related, as well as drug side effects and injury along with blasts and explosions as it has there. And then probably two more like really important things there are impacted earwax. That's just when earwax builds up so much that sound can't get through anymore, or it can't get through as effectively. And so that's something that is a cause of hearing loss, but is easily like treatable and fixable. So those are kind of like the main causes and risk factors of hearing loss. And you can kind of just work on prevention and all of these things. Like with noise damage, you can wear earplugs or headphones of some sort in loud places to keep you from doing that, or even just avoid going to the loud places.
I think these are important things to understand too, especially applying this back to as possible future healthcare providers. If you understand all of these, it can help guide you in the types of questions that you're asking your patients who may be experiencing some hearing loss to kind of figure out what type they have so that you can better treat them. So thanks, that was really helpful. And then that goes right into treating hearing loss.
Okay, yeah, so there's a few options for how you can treat hearing loss. One of these options is using hearing aids or a hearing aid, depending on if you have both ears that have hearing loss. Hearing aids just amplify the sounds for you so you can hear them a little bit louder. Another option is with assistive devices. So these are just devices that can help you if you do have hearing loss. Some examples of this could just be different like alerting devices. So like if your doorbell rings, there could be something that flashes to let you know that happens. Or with telephones, there could be devices that you can put on there to amplify the sound or that convert speech to text. This is stuff so that you can communicate easier with other people. Another option is also like the cochlear implant, like we were hearing about in the movie. With this one, this can restore hearing a little bit, but it does require like a surgery with it. But these are all ways that you can treat hearing loss. And then if you go to the next screen, yeah, we also have some ideas for how you can manage hearing loss. So one is you can get trained in like speech reading. So you can look at the visual cues when someone is talking to kind of understand what they're saying. Another idea, which Josh mentioned earlier, is you can avoid loud noises and then lower the noise exposure you get just to protect the hearing you still have. And third is just you can use methods to prevent too much wax buildup in your outer ear. So this is also kind of similar to what Josh was saying, but that wax can make it hard for you to hear sometimes. So just making sure that you have ways to clear that out can be helpful in managing hearing loss.
Great, thanks, Brittany. Okay, so next, we are really excited about this portion of our conference. We have a special guest here today who's Dr. Danny Doe, and he happens to be the world's youngest otolaryngologist. So we're very grateful that he was willing to come on today and talk with us. So we've got a couple of questions prepared for him. The first question that we'd like to ask Dr. Danny Doe is, what is something that you think is important for providers to understand about caring for those with hearing loss?
Yeah, thanks, Ella. First, I'd just like to say I'm so happy to be here, and my doppelganger Josh did such a great job. I'm so proud of him. He's really incredible. You guys should definitely listen and think really carefully about what he said. So like Ella said earlier, I'm an otolaryngologist, which most of you have probably just referred to a doctor like me as an ear, nose, and throat doctor or an ENT. And so I deal with all issues dealing with your ears or the sinuses, or if you get bloody noses a lot, I can handle it, or if there's some sort of issue in your throat, that's kind of what I do. I mostly see older patients as part of that. Like we were talking about, the older people are kind of the people that are more at risk for a lot of these problems. But to answer your question, how can we care better for people with hearing loss? Something that I think is really important that I've noticed with my patients and in my own life is that we really just need to be more informed when we are referring to people with hearing loss or hearing impairment or even deafness. For a lot of these people who have been able to hear fine for most of their younger life, and then suddenly they get older and they can't hear as well anymore, it can be really frustrating. They aren't able to like localize sounds as well. They can't hear a lot of noises that are higher pitched, and they misinterpret a lot of what you might say. And while that may be really frustrating for you, I think it's equally, if not more frustrating for them. And so I think just being able to come from a place where we acknowledge that there's these changes happening with them, that we need to be able to be compassionate about and to relate to them and be able to see from their point of view.
Right, that makes sense. Another thing that we had was, what is the most common source of hearing loss in your patients?
Yeah, so actually, I think probably the most common thing that I see in my patients that they'll come and see me for is impacted earwax, which I think we talked a little bit about earlier. But just when that earwax builds up, as you get older, the earwax will continue to build up at an increasing rate. I think you may have heard that like your ears and your nose, they keep growing throughout your whole life, whereas the rest of you doesn't. Well, maybe your stomach, but but because all of that's still growing and functioning, the function increases, right? And so a lot of them come in with this earwax buildup that they just need me to remove. And so I have this little vacuum that I just stick in there and I just slurp it out. And then they're able to hear a lot better. But as far as permanent hearing loss goes, it's definitely some of that sensory neural hearing loss that comes from noise exposure in older adults.
Thank you so much for coming on with us today.
Happy to help. Thanks for having me.
Thanks for coming. Okay, let's see. So now we're going to open up to any questions that our audience members may have. So looks like we have, how can we help someone who has hearing loss? Let's see. Brittany or Josh, would either of you like to respond to this one?
Yeah, so I can handle that first one. How can we help someone we know who has hearing loss? This is actually really important to me because I'm half deaf. I can't hear out of my right ear. And I've been that way since I was a little kid. So I think as far as something that we can do to help other people is just remembering a lot of the things that we talked about today. It's the things that Dr. Danny Doe talked about as far as how to help them, but especially like being able to notice if somebody that you know and love starts to become more socially withdrawn, is unable to like interpret your words correctly, or if they start showing a lot of those risks and symptoms that we talked about earlier of hearing loss, so that we can help them be comfortable with it and get the help that they need.
Great, thanks. And then the second question we have is, can diet affect your hearing?
Perfect. I can take that one. Yeah, that's a great question. So studies do suggest that some of the foods we eat can help in preventing or slowing down hearing loss. Some foods that could help with this include foods with potassium, zinc, or oxalic acid. But these foods cannot help you regain your hearing once you have lost it. So I think this shows that what you eat is very important, and to just be mindful of what you have in your diet.
That's interesting. I had never considered that one before. Okay, so now we're going to have a quiz for the audience with just a couple questions, most of which we've covered the answers so far. So our first one is, what is the most common type of hearing loss? And we'll just go over the answers to these So this one, as Josh mentioned, is A, sensory neural. That's the most common type. Question 2, we have what is one way hearing loss is diagnosed? And the answer to this is C, an audiogram. So you can go into a doctor like Dr. Danny Doe and get one of these done if you suspect you may have hearing loss. Number 3, how many people experience hearing loss due to loud noise? And I don't know about you guys, but that is the one thing that I would be most concerned about for myself, because I feel like I have headphones in like daily, and that's probably not great for my hearing. But the answer to this one is B, which is 1 in 4, so quite common. Number 4, which of the following is not a way to treat or manage for hearing loss? And the answer to this one is increased radio volume. So hearing aid, assistive devices, and speech reading, those are all ways that you can manage your hearing loss. And that was all that we had prepared for you guys today. So thanks for listening, and thanks to Brittany and Josh and Dr. Danny Doe for being here with us today.